Did you know that 1 in 3 women and 1 in 6 men experience some form of sexual trauma in their lifetime? Yet many survivors feel isolated, ashamed, or unsure of how to heal. Sex-based trauma isn't just about what happened. It's about how it changes the brain, body, and emotions. But understanding it is the first step toward reclaiming power and healing. Let's talk about what sex-based trauma really is, and most importantly, how healing is possible. What is sex-based trauma? Sex-based trauma is any experience of unwanted sexual contact, coercion, or assault that causes lasting emotional, psychological, or physical distress. It can happen to anyone, regardless of gender, age, or background. Many survivors experience fear, guilt, shame, anxiety, and even PTSD as a result of their trauma. The brain goes into survival mode, triggering the fight, flight, or freeze response. And when trauma isn't processed, it can remain trapped in the body for years. How trauma affects the brain and body. Sexual trauma isn't just emotional, it rewires the brain. Studies show that trauma can shrink the hippocampus, the part of the brain responsible for memory and emotional regulation, and overactivate the amygdala, which controls fear and survival instincts. This is why survivors may experience flashbacks and nightmares, difficulty trusting others, emotional numbness or sudden mood swings, physical symptoms like chronic pain, fatigue, or digestive issues. Understanding these effects helps survivors see that their reactions are not their fault. It's how the brain protects itself. Steps toward healing. Healing from sex-based trauma is not about just moving on. It's about reclaiming control, safety, and self-worth. Here are key steps that can help. Many survivors struggle with self-blame or minimize their trauma. But the truth is, your feelings are valid. Speaking with a trusted friend, therapist, or support group can help break the silence and start the healing process. Therapy is one of the most effective ways to heal. Trauma-focused therapy, such as cognitive behavioral therapy, CBT, EMDR, or somatic therapy, can help survivors process their experiences safely. If therapy isn't accessible, there are free hotlines and online support groups that can provide guidance. Trauma makes the world feel dangerous. Creating small rituals of safety can help rewire the brain. Simple things like grounding exercises, deep breathing, or self-defense classes can help survivors feel more in control of their bodies and environment. Sexual trauma often leads to disconnection from the body. Movement-based practices like dance or even gentle stretching can help rebuild trust in oneself. These activities allow survivors to regain control over their physical and emotional space at their own pace. Boundaries are key to healing. Survivors should never feel pressured to get over it or return to intimacy before they're ready. Hope and moving forward. Healing isn't about erasing the past. It's about building a future where trauma doesn't control you. It takes time, patience, and support. But every step forward is a victory. If you or someone you know is struggling, remember, help is available and healing is possible.